shouldn't be surprising that one of the fastest growing segments of cosmetic enhancement are young women and now even young men in their 20s. Born into an era of rampant technological advances, they easily embrace the latest innovations as a natural part of modern life. 24-year-old Helen Dunn is one of those Generation Xers who has no reluctance to make a tweak here and there to improve what nature's already generously bestowed.
Today I'm going to have my breasts enlarged, I'm going to have my nose done, and some liposuction. I'm really comfortable with technology. That part I'm not worried about. And then there's risk with everything you do. What's life if you don't take risks? I felt like I deserved this operation. I work hard every day. I have 3 children. I'm in school full time. I run a household. I don't have a housekeeper. I manage their social lives. I manage my significant other's social life, and I manage my social life, what little social life I have. So I just felt like this is something that I deserve.
If she wanted bigger breasts, to her the next step seemed obvious.
I'm going to get it done. I need to go where, everybody goes, where they do the best job. So I was like, why not go to L.A.? Everybody has, new breasts in L.A.
Helen found Dr. Stevens via the internet, and he will perform her breast augmentation, nose job, and liposuction.
Everybody's nervous. This is Los Angeles, and people are always striving for perfect bodies. Admittedly, many people would love to have this as their final result. But Helen wants to make it even better and have me smooth this out and get rid of this little bulge right here.
One recent innovation in breast enlargement is the teardrop-shaped implant.
This is a smooth-walled, round saline implant, and this is a textured saline with an anatomic design. You can see this is round and equal in all dimensions, whereas this is thinner at the top and a higher projection at the base, so that it would stay on the patient's body like so, in a more anatomic fashion. Helen, I'd like to talk to you about your nose now and just what you'd like me to do for it. I understand there's somebody you'd like to look like after today's surgery.
I like Halle Berry's nose.
Halle Berry, huh?
She has a nice nose.
She does, doesn't
Yes.
she? What about her nose do you like?
I like the way it's shaped, and it still has an ethnic shape to it.
When you look in the mirror and you see your tip comes out a little bit, it's a little boxy. Her nose is more in here, right? But otherwise it looks very similar to your nose.
Right.
So we won't be doing too much up here. You have a beautiful tip here.
Helen's biggest concern, though not a large one, is not what she'll look like. She's nervous about the anesthesia. Naturally so. It's one of the major risks of surgery. But Dr. Stevens' anesthesiologist employs a futuristic little gadget that may help calm her nerves.
This is a BIS monitor, and it's a bispectral analysis of the EEG, which is your brain waves.
The numerical readout corresponds with consciousness. An alert person registers in the 90s. Under 65 and the brain is completely unconscious. There are 2 advantages to this. First, after hearing horror stories of patients who could remember surgery under anesthesia, many patients appreciate the assurance the BIS monitor gives them that they will indeed be completely knocked out. Second, as the surgery is nearing an end, the anesthesia can safely be lightened without the danger of the patient waking too early. The overall result is a lighter, more finely controlled anesthetic.
Just relax, take some nice slow, deep breaths. Think about your favorite place to be.
Not here.
Not here, maybe Tahiti or nice warm sunny beach someplace. And that's where I'll send you for a little while.
In minutes, the BIS monitor confirms that the operation can begin.
Here's the indentation I showed you earlier. You want to stay out of there? Dr. Claire, what's her BIS monitor? Okay, why don't we prep her nose now?
Helen's nose job, known as a rhinoplasty, will entail removing cartilage at the tip.
The tip of the nose is somewhat like an Oreo cookie in that there's skin on the outside and skin on the inside, and the middle is cartilage. We remove a portion of this cartilage and thereby narrow the tip of the nose.
And breaking the nose to thin the bridge. A splint is placed on the nose to help the cartilage memorize its new position. This may look like it's going to hurt after surgery, but Dr. Stevens has assured Helen that she probably won't even notice it, compared to the pain of the breast implants.
Is that all right?
There are a wide variety of breast implants and methods of placing them. The incision may be under the arm, under the fold of the breast, or even tunneled up through the navel. Dr. Stevens is placing Helen's through an incision just below her nipple.
Put an incision right. This is a 390 cc. We will be doing a submuscular breast augmentation, which means simply that the breast implant is below the muscle. By placing the implant beneath the muscle, we won't feel the implant as much because the muscle will buffer the ability to feel the implant. And probably most importantly, mammograms will be easier to read.
The safety concerns over breast implants have a rich history. Silicone implants were originally marketed before regulations required proof of safety. Following mounting health concerns and lawsuits against the manufacturers, they were removed from the market and are currently under study. One futuristic dream is that tissue engineering might someday allow a breast to be enlarged with one's own tissue and do away with implants altogether.
This is a tissue adhesive or tissue glue. This is a new product which we apply to the skin edges, eliminating the need for sutures. It also eliminates the need for suture removal. So we have just closed the incision without any stitches, thanks to this tissue glue.
In little more time than it might take to go to a movie, Helen's body is reshaped. It has been less than 2 months since Helen's surgery, although she's still not completely healed. She already knows what she thinks of the results.
Very happy with my breasts. They're great. My clothes look great. I have no pain. They move. They feel really natural. They actually feel like a part of me now. The first 2 weeks, they actually feel like alien. They don't feel like they belong to you. But probably about the third week, you start feeling like, okay, and you don't have so much pain. But I do have to say, that first week, I was like, maybe I shouldn't have done this. There's hardly any scarring. It's right on the edge, so it kind of blends into where my skin changes colors. The favorite part of my nose is that I had like extreme boxiness at the very tip, and that's gone. So I'm just waiting for some of the swelling to go down. I know I'm still healing. I'm still going through recovery, so I just have to be patient. That's about the only thing.